Imagine this. It's early morning. Sunlight quietly fills your room. You walk toward the mirror, and for a moment, you just look at yourself. Not at wrinkles, not at gray hair, but at experience, at survival, at strength. You're in your 50s now, and this is not the end of youth. This is the beginning of awareness. Because here's the truth. Most serious diseases in your 50s don't start in your 50s. They start silently, 10, 15, sometimes 20 years earlier. And that's why this decade matters. Let me tell you something important. Colon cancer is still one of the leading causes of cancer deaths in the US. But here's what many people don't realize. Colon cancer is one of the few cancers we can actually prevent. Yes, prevent. How? Because it usually begins as small growths called polyps. And these polyps can take 10 to 15 years to turn into cancer. That's a long window, a powerful window. And that's why, since updated medical guidelines, screening now starts at age 45, not 50. A colonoscopy doesn't just detect cancer. It removes precancerous polyps before they become dangerous. That means you're not just testing, you're preventing. If colonoscopy feels intimidating, there are other options. FIT stool tests, stool DNA tests, CT colonography. The key is not the method, the key is action. Because early stage colon cancer has over a 90% survival rate, late stage, that number drops significantly. And that difference is timing. Now let's talk about something personal. You step on the scale, and suddenly, it's not the number you remember. Here's why. After age 50, muscle mass naturally declines. It's called sarcopenia. Metabolism slows down. Hormones shift. For women, estrogen drops. For men, testosterone gradually declines. And scientifically, muscle burns more calories than fat. So when muscle decreases, your body burns fewer calories, even at rest. That's biology, not failure. But here's the empowering part. Even losing 5 to 10% of your body weight can reduce blood pressure, blood sugar, cholesterol, inflammation. It lowers heart disease risk significantly. This isn't about looking younger, it's about aging stronger. Add strength training twice a week, increase protein intake, walk daily, small changes, compound over time. High blood pressure is called the silent killer because it doesn't knock before entering. You feel fine. You go to work, you laugh. Meanwhile, inside your arteries, constant pressure damages delicate blood vessel walls. Over time, it can cause heart attacks, strokes, kidney failure, vision loss. And here's something powerful. For every 20-point rise in systolic blood pressure, your risk of cardiovascular death doubles. Doubles. Checking your blood pressure takes less than 2 minutes. Ignoring it can cost decades. Cholesterol itself is not evil. Your body actually needs it to build hormones and cells. But LDL, the so-called bad cholesterol, can slowly deposit inside artery walls. This forms plaque. Plaque narrows arteries, narrows blood flow, and sometimes, without warning, a plaque ruptures. That's how heart attacks happen. Studies show lowering LDL significantly reduces heart attack risk, even in people over 50. And modern medications like statins have been proven to reduce mortality. But lifestyle still matters. Fiber, omega-3 fats, exercise. Control your cholesterol, and you literally extend your life expectancy. And next, type 2 diabetes often whispers before it screams. You may feel slightly tired, a little thirsty, or nothing at all. But elevated blood sugar slowly damages nerves, blood vessels, eyes, kidneys. Prediabetes can exist for years. But here's the hopeful part. Prediabetes is reversible. Research shows that moderate weight loss and 150 minutes of weekly exercise can reduce diabetes risk by nearly 58%, more powerful than many medications. So test your fasting blood sugar or your A1C, because catching it early changes everything. Next is for women only, that is pelvic exam and pap smear combining. Pap smear and HPV testing allows longer intervals, up to 5 years, if results are normal. HPV causes nearly all cervical cancers, and testing today is more accurate than ever. For breast cancer, mammograms detect tumors years before they can be felt. Early detection means higher survival, less aggressive treatment. This is not fear-based medicine, it's proactive care. For men, prostate health, calm, balanced tone. Prostate cancer screening isn't one size fits all. The PSA blood test measures prostate-specific antigen levels. High levels don't always mean cancer, but they signal further evaluation. Men over 50 should discuss risks and benefits with their doctor, especially if there's family history. Conversation leads to clarity. Silence leads to uncertainty. At age 50, men should have a conversation with their doctor about prostate cancer screening. This often includes a PSA blood test. For African American men, or men with a close relative who had early prostate cancer, that conversation should happen even earlier. Screening decisions are personal, but discussion is essential. Take a moment, look at your skin. Any new moles, any changing spots? Skin cancer becomes more common with age. If something looks new, unusual, or changing, get it checked. If you've had skin cancer before, regular dermatology visits are even more important. Vision-robbing diseases become more common in your 50s. Glaucoma, macular degeneration, diabetic eye disease. Have your eyes examined every 1 to 3 years until age 60. Then every year after that. If you already have vision problems or risk factors, go more often. Your eyesight connects you to the world. Protect it. And next most important is hepatitis C screening. Current CDC guidelines recommend at least one hepatitis C test for all adults 18 and older. If you've never been tested, now is the time. Hepatitis C can quietly damage the liver for decades without symptoms, and today it is highly treatable. Now let's talk about depression, screeningest of all. Keep one thing in mind, that depression is not weakness. It is not just aging. It is not something you have to silently endure. In your 50s, life transitions can trigger emotional changes. If you feel sad, hopeless, withdrawn, or uninterested in things you once loved, talk to your doctor. A simple questionnaire can help identify depression. Treatment works. You deserve emotional health too. And as your immune system weakens with age, flu shot, every year. Shingles vaccine, recommended at 50 and older. COVID-19 boosters, as recommended. Tdap booster, every 10 years. Pneumococcal vaccine, discuss at 50 plus if risk factors are present. Vaccines aren't just for children. They protect you when your immune system naturally weakens with age. Your 50s are not about decline. They are about direction. This is the decade where wisdom meets action, where experience meets prevention. Schedule the tests, have the conversations, listen to your body. Because the goal is not just to live longer, it's to live stronger. And the healthiest chapter of your life may still be ahead of you. Take care of yourself, because you've earned it.